Hello, my name is Russell Yamas, and today I'll be doing a musculoskeletal return demonstration. First, before I proceed, I have to wash my hands and then explain the procedure to the patient. Okay, first, I'm going to inspect for some gaits. Okay, Mike, I need to stand up and then walk so that I could know your movements to see if you're limping or feeling any pain. As of right now, he's not feeling any pain. He's walking perfectly. Okay, that's good. Next, I'm going to perform the nudge test. Okay, Mike, I need to stand up. I'm going to need to stand behind my patient over here, and then now I need to touch the sternum gently to check his balance. He's not falling, so he's perfectly balanced. Next, I'm going to be palpating his temporomandibular muscles. That would be, for me to do this, I need to palpate, I need to inspect right here and tell him to open his mouth to check if there's if he feels any pain or if I hear any clicking. Open your mouth, close and open, close and open. Okay, good so far. Next, I'm gonna check his sternocleidomastoid joint. I'm gonna check if there's any swollenness or redness, and then palpate this area right here to check if you can feel any pain or any disturbance, or if he feels any pain. Okay. Yeah. Next, I'm going to be checking his spine. Mike, I need you to stand up. I need you to take off your shirt so I could do this properly. Okay. I need to check if he's standing straight. Make sure his posture is good. And then now, I'm going to be palpating his spinal area to check if there's any pain, if he feels any pain or if there's any abnormalities. I'm also going to check on around his neck, shoulder, right here on his back, and on his neck. Okay, now I need him to move his neck. Michael, can you move your neck forward like this? Yeah. Now this is where we have to do his extension. His full extension for his neck should be 75 right here. If it's going up, it should be 35. Sideways, it should be more of, well, I think 30 degrees. Okay, next, Michael, I need you. Okay, Mike, next, I need you to bend your back. No, not like that. I mean, like, touch the ground. Try touching the ground. Okay, he doesn't feel any abnormalities. Now, you think you can do sideways now? Try sleep. No. Stand up straight, like that, and do the other side. Okay, that's good. Okay, good. Okay, now I need you to lay down for a bit. I'm also going to test your leg strength. Now, leg straight. Now I'm also need to test his leg strength. First, I need my patient to lay on his back and then rise his leg. Well, if he's feeling any pain, I should stop. So, as of right now, I'm checking each leg if he feels any pain. I'm checking his leg strength right here. Now, I'm going to be measuring his legs. I could do this as truth or apparent. First, I'm going to start where the umbilicus is and to the midpoint. As of right now, both his legs are equal length and size. Next, I'm going to be inspecting his shoulder and elbow. First, I'll start at his shoulder. I'll check if there's any. Now, I'm going to be inspecting and palpating to see if there's any pain or any skin coloring changes. Now, the same thing goes for the elbow. I need to check I'm going to palpate to see if there's any pain or anything else, like redness and if his joints are okay. Okay, I'm going to need you to move your arms up and down. I'm going to see his range of motion. Range of motion for that is okay. Now, sideways. Now, third one, be in this position. Okay, good. Now, I need to see the flexion of his elbow. Okay, move your elbow. The normal should be 90 degrees, while the full flexion should be 160. 160. Now, I'm going to be inspecting and palpating on his wrist to see if there's any pain or any skin coloring changes. I have to do this way so that I could see if there's anything wrong. Okay. Okay. Good. Now I'm going to check his other side. Now, I'm also going to palpate this area of his thumb right here to see if there's any pain or any dislocation of joints. And then now I'm going to check his range of motion. I'm going to need him to move his arms up and down. Okay, good. Keep going. Okay, now do like this. Range of motion is okay. No abnormalities there. Okay, now I'm going to test if he has a carpal tunnel syndrome. To identify if he has a carpal tunnel syndrome, there are two ways. First, I'm going to be checking through his wrist right here. I could do this in two ways. I could use this as a reflex hammer and then tap to see if he feels any numbness or pain. Or I could just tap it if he feels any numbness or tingling. The other way to do this is to do the pliance test. I need him to put in this position to see how long it can last. Normally, this will last. If he does this for 60 seconds and feel numbness and pain, he has a carpal tunnel syndrome. But if he doesn't feel anything, he doesn't have a carpal tunnel syndrome. Okay, next I'm going to inspect his hand to see if there's any numbness, any pain or numbness. First, I'm going to palpate his fingers to see if there's any misshape, injuries, or ingrowth. Now I'm going to inspect the rest of his hand to see if he feels any pain or if there's any other injury in place. I'm going to be checking his fingers if there's any pain or any misplaced joint, and then now his hand to see if there's anything wrong. Okay, next I need to do is see his range of motion. First, I need you to close your fist. Okay, keep doing this. Okay, range of motion is okay. Now, I need you to open your hand. Okay, good. Range of motion is okay. Now, close your fingers. No. Yeah, that's it. Okay. Good. Now, can you move your hand like this? No. Yeah, that. Close your fist. Can you twist it? Okay. Good. 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 Do this now. Okay. My patient's fingers and range of motion is okay. Now, I'll be also checking his buttocks. Okay, lay down forward. Now, I'm going to be inspecting his butt and palpate to see if he can feel any pain or feel any pain, numbness, or any kind of injury. As of right now, he's not feeling any pain, so he's okay. I'm also checking for any stability and tenderness, and to check if there's any pain or not. Okay, Mike, I need to stand up for a bit now. Now, I'm going to check his range of motion. First, I need you to move your leg. Okay, that's good. Good, good. Now, knees up. Alright, lay down again. Now, inward and outward. No. Inward, inward, outward. Okay, good. So, his range of motion for his buttocks is fine. Now, I'm going to check his knees. I'm going to palpate his knees right over here to check if there's any pain or maybe even skin color, different kind of numbness as well. Okay, now I'm gonna perform or check swelling on his knee, called the development test. First, I'm gonna put my arm here and put my fingers above the thigh. Now I'm gonna test the palate to check if there's any fluid. If it bounces back, there's fluid. That means his knee is swelling. As of right now, there is no fluid. Okay. Now I'm gonna check his other knee. Nothing there. Next, I'm gonna see if there's any bulging on his knee. So, I'm going to tap right here to see if there's any bulging or anything else. As of right now, I don't see any bulging or any leftover fluid on his knee. Okay, next I'm going to check his range of motion for his knee. Okay, I need you to flex your knee. I'm going to extend it and rotate. Now I'm going to check your other knee. Okay, now I'm going to be inspecting and palpating his feet. First, I'm going to inspect his feet if there's any skin coloring or anything like numbness or pain. First, I'm going to palpate his feet to see if he feels anything. As of right now, he doesn't feel anything. I'm going to check his other side. Nothing wrong. Everything's okay. Everything's good. Now, for the flex, I need you to move your feet. Sit down. Oh. Now, put your feet up for a bit. And move it up and down. Okay, good. Now sideways. Now your other foot. And then sideways. And now try moving it around. Okay, everything is good. The feet are in the normal range of motion, and that's all.